The message that I'm trying to share with this little presentation is an extremely important one for my form of practice, and I have the privilege, to share that with a very understanding patient on a case report basis. So you see, the case here, before of the patient, the after actually had 2 rounds of BBL, and I know that many of my patients consider these before and afters a little bit boring, but for us, if you look at the measurements that we usually take, you have a very drastic result, a change of the waist to hip ratio from 1, which is more or less straight, to 0.68. That is what we would qualify as a very impressive outcome. Now, everything great. The patients send us pictures like this, and trust me, you can't make your surgeon any happier than by sending him a picture like this. Of course, this is like a little bit positively posed. It's good lighting, it's nice underwear. It looks fine. Now, a couple of weeks later, we get a photo like this. And I think this is a great example to demonstrate that how important lighting is for a photo, because there is, to my humble opinion, nothing wrong with the result of the skin, but this is a catastrophic lighting coming from cold light coming from 30 degrees above. That makes everybody look far worse than it does, and the consequences for the patients can be a bit detrimental, because I know that from experience is it's the good and the bad about these body contouring surgeries. Patients usually love the results. They look a lot in the mirror and then they start to find little things, and the over excessive presence or availability of photographs now has created for us, on the other hand, a bit of problems, because when patients take photos in this extremely horrible lighting, and sometimes take very odd positions. In this case, the patient actually said to us, "Look, it doesn't look like that in real life. It's just in the bathroom. That light, then they call what I call a bit self-caused stress or autotoxicity." The same thing with the tummy. Sometimes the difference between a flat tummy and a bloated tummy is simply breathing in and out. And these are things that we have to judge when we look at photos. And what I want to share with you is a person, which are personal. It's not my patient, nor do I even know her, but I'm a great fan of her. She's I think, an Australian influencer. And she's done a whole series, which I like to share with our patient community. And I think that's also good for colleagues who have a very high outpatient percentage. And she's done a series of photos to demonstrate how bad lighting can completely destroy the impression of a picture. You see here, I don't know, I don't think she's in surgery, but you see the arm is perfect here. It looks really strange here, but what is the difference? It's the lighting. A classic is patients bend over in very, very odd angles, and of course skin will fold, because if your skin doesn't fold, you can't bend over. So, and you have to, and I think we all need that understanding in the social media age. Yeah, that somebody who straightens herself up and shows themselves in a good light will of course look completely different. So that is clear. When you fold, when you bend, your skin will fold. No surgery in the world will stop from doing that. I think I love that one. Is you see here, breathing in, breathing out. After a big meal, tummy is bloated. So I think we need both surgeons and patients in times as modern as these, a certain understanding for that. And I need to be very clear on my patients, because to look after them, I don't need post photos. I need neutral photos to assess, to evaluate, and in the case of doubt, advice. This is something that I think is the ABC of influencers, very well known. You slightly kink the hip, and you put one leg a little bit back, and your bottom will look twice as impressive. Many people enjoy doing that, and I think it's nice. But I want patients to understand the difference and evaluate, see this whole little bit with a filter here. Same dress, breathe in, breathe out. These are the things that are outside the control of any surgery. So, in conclusion, I think, is we have a great community of patients who should send us these wonderful pictures that the patients enjoy, and we enjoy, and we want patients to enjoy. These surgeries give an extremely positive spin, but we also, at the same time, and I'm always trying very hard, when I involve my patients to tell them, look, I need neutral photos to judge your result afterwards and help keep a healthy filter about the influence of bad lighting and bad positions. I want to look after you well, and I can't do that with bad photos. So I think if you want to show yourself in your best light, that's very good for your self-esteem. It's good for your mental health, but don't let yourself drag you down by consciously taking photos and bad lights. But what we need to look after every patient is neutral photos with neutral lighting to make good assessment.